Furry children waiting to be slaughtered on the dog meat truck. His eyes were filled with fear and helplessness. Samoyed with runny nose and a bad mental state. Look at this Samo. Why do I see Samoyed's nose running? Cold County. Look, there are two more behind this. A car full of furry kids of all sizes. They rely on each other for a sense of security. We can't watch these furry kids lose their lives. Become a delicacy on the human table. After a fierce. Finally, they were rescued for 8,000 yuan, looking at the eyes of the furry children who are eager to survive. We will save them at all costs. The most serious one is this Samoyed. We are worried that the nose is flowing and it is an infectious disease. It was tested and the result was negative. At first we thought our pet just had a common cold. After taking the medicine, the child still keeps wheezing and coughing. Let's eat. Not much to eat. It's not young anymore. Not eating much. I didn't dare to delay and rushed my fur baby to the hospital as soon as possible. The child is in a very bad condition and has no appetite. After the inspection by President Sun, it is initially suspected that the child's cough and asthma are caused by respiratory pneumonia. However, the cause of the disease still needs further testing of the fur child to determine. Pneumonia is serious. Such white pieces. To what extent is this? Anyway, the whole lung is a layer of white lung. What we didn't expect was that the child's pneumonia was very serious. The whole lung has turned white. The blood test results were also bad. Inflammation indicators in the body are off the charts. Anemia also affects the internal organs. Immediate anti-inflammatory treatment is required. Its thick hair makes it look very strong, but only more than 20 pounds. Arrange hospitalization for treatment of fur children. The furry child is listless and keeps coughing and wheezing. No appetite at all. We are very worried about the condition of our furry children, yet I feel powerless. Quite serious. This white lung is too difficult to treat. Give your furry child an injection every day to reduce inflammation, but the furry child has no spirit or state. The food prepared for it every day did not touch it at all. We can only adopt compulsory feeding. If a furry child doesn't eat or drink, his body will have no resistance. I don't have the strength to fight the disease. The Fan's family also sent goat milk powder at this time. We reluctantly fed our fur kid some goat milk powder. A few days of treatment made us more worried. What if the child continues to be in this state? Still coughing a lot. Okay. Still coughing. The cough is so severe. Anyway, I still have to ask Dean's son later. Just cough like this. It's really annoying, because its entire lungs turned white. The inflammation is too severe. The cough is too severe. Is there any other way? Just to make it get better faster. Don't let it cough. Have. There are good antibiotics available. Good antibiotics. Kindness. How much does Xingna cost? 400 yuan a day. Day 400. Day 400. Seeing our furry child in such pain, we are also anxious. Dean's son said there are better antibiotics available for furry children. But the price is very expensive, 400 yuan a day. In view of the financial pressure, President Sun said that we should consider the virtual examination. Check your child's physical condition. But the result was not satisfactory. The decline in the physical indicators of the fur child is not very obvious. Developed resistance to common drugs. Continued use has little effect. For the recovery of the furry child, we decided to use better antibiotics for our fur babies, no matter how much it costs. We are also very sad to see the furry child coughing and wheezing. I kept praying in my heart that better antibiotics would be effective for my furry children. Let your furry children suffer less torture and pain and avoid accidents. At this time, a kind sister saw the condition of the fur child. I feel very sad and worried about the situation of my furry children. Provides help for special medicines used by furry children. Reduced the burden on our courtyard. Thank you very much to the family who cares and helps the fur children. Since then, the furry child has started a week-long treatment. We accompany our fur kids for intravenous treatment every day. Prepare a variety of nutritious food for your furry children. God will not let down those who work hard. The furry child finally has energy and appetite. Let me see what delicious food I can bring you. Look how delicious it tastes. My appetite has improved. Right. I look at your nose. Come here, dear. Look at your nose. Nose delivery. No more snot. Okay. Okay. We are very pleased to see the changes in our fur children. All the efforts are worth it. Come over. Yo yo yo. The furry kid looks so cute when he smiles. Hey hey. How come you are so obedient? You are so obedient. Look, you are happy. Look, you are happy. Like a lion cub. Lie down. Sit down. Be obedient. Go inside. Oops, it really came to light. It's really smart. Yes, you are really obedient. This little kid is so smart. Go inside. Hey, come over. You are so awesome. It's awesome. That's great for it. The furry kid is very smart. Fans and family members gave it the name Thatsone. Let's go. Can I take you out of the hospital? Take you out of the hospital. Time passed quickly and the furry child was discharged from the hospital. After being imprisoned in the hospital for more than half a month, the furry child seemed to be running wild when he came out. The smile on my face never fades. This girl is what a furry child should be like. Love and companionship can heal everything. Release your nature wantonly. Be a happy, blessed, and free child. How are those three little furry kids? Big. Bigger's condition is not particularly good, panting heavily, not eating. I think I'm really serious. Is today not good? Not good. Today's status is not good. What about the county? Tibial virus. Right. It has diarrhea. It has diarrhea today. Diarrhea today. The cage and the mat are all covered with. I haven't been fed for days. Eat something special. I'm going to test it for viruses later. Get tested for parasites or other infectious diseases. I'm considering whether it's viral. If there is no virus possible. Temperature difference or eating food to change food. What's the reason? If that's the case, it's fine. I'm afraid there's a virus. Xing should be fine. The Rottweiler should be fine. Rottweiler. Basically normal. Okay, that's okay. That's okay. President's son, I'll go up and take a look. You feed Xing bigger. It wants to eat. You can feed Fu Wang, a big yellow dog with tibial virus. Don't feed it yet. Does this nutritional cream also work? Don't feed yet. What about driving people from within the county? Can an external drive give it a drop? External drive can drive. Xing, I'll give all three of them a deworming. Don't use that little beagle yet. Don't drive beagle. Bigger is in bad condition. 2 days of treatment with special medicine and oxygen chamber. There is still no good news for the fur kid. When the fur child was found, the pneumonia was already at its worst stage. The furry child suffered the double injury of having his ears cropped and his front limbs amputated. In the end, he got sick but still had to accept his fate of being put into a sack and abandoned. Give it an fur first. Now, President Sun said, it's also best not to feed it anything. Let's not bother with it. Fu Wang had been in the hospital for a few days and then had diarrhea. I'll test it for viruses later to find out the cause. I'll give it some insect repellent later. If you have internal drive, it's best not to feed it first. Just give it a drop of light, as Dean Sun said. Fu Wang's sudden diarrhea should be ruled out as a viral infection. Fu Wang is watching us. Don't feed it too much, because now it has diarrhea. Fu Wang still eats voraciously. Okay. Also have appetite. Right. Eaten it all. Didn't eat. Eat. I need to give it some insect repellent. Come out. Be good. Deworming. We still have to give it to our little kid. Disinfect the mat we brought. Go inside. Fu Wang's hind legs can also be seen to have improved. The physical conditions of the 3 furry children are mixed. Our moods are like a roller coaster, with ups and downs. Our moods are like a roller coaster, going up and down. Back to this little nest again. It's so comfortable. Look, it's happy. How did you do it? Not adapting. I still have to mess this up. This cushion is too soft. How comfortable. You see, this is comfortable. It looks pretty good. Yes or no? What about now? It's not that it's against us anymore. Look at how big it is now. 3 furry children in hospital. Only Liu Qingna seems to have recovered well. The little bitch eats elegantly. It's just better than our Fu Wang. That's our Fu Wang. Eating is elegant. Now, then we also have a fan family. Let's name our little kid Nana. Add a Nana to the character 4. Still very consistent. Our Liu Qingna has a unique personality. Special tenderness. Look how delicious it tastes. Nana is very shameful. It knows it's medicine, but it won't take it. No matter how smart you are, you can't resist the temptation of delicious food. Eat all. Now 3 fur children are hospitalized at the same time. There are more than 100 furry children in the yard who need to be taken care of. 3. We run back and forth between the hospital and the courtyard every day. The daily expenses of more than 100 furry children are a considerable expense. Now the 3 little kids are hospitalized at the same time and are receiving medication every day. Another ever-increasing expense. The money I already owe to the hospital is piling up. Let me wipe your body. Do you want to play? Give. For you to play. Let you play. Take it in. Dean Sun said Nana is recovering well. All physical indicators have returned to normal, and my appetite and spirits are also very good. Dean, what I just said. Rhubarb. It's called Fu Wang. Fu Wang. Then let's look at its appetite. It's much better than before. But what is the cause of this diarrhea? Diarrhea, just to test the virus. No viruses or bugs. Then consider whether it is eaten or exchanged for food. Or maybe it's because it still has a little cough. Give it some use. Azithromycin drug reaction. These factors are possible. If these factors, maybe you can slow down. Stop taking the medicine or it will get better slowly. You can get better by yourself. Yes, it's a normal gastrointestinal reaction. How long does it take to inject now? If it doesn't cough or have diarrhea. Basically, nothing happened, because now his spirit and appetite are fine. Its legs are still recovering. Its legs will definitely not recover well, but it can stand up. It can walk without surgery. Like this. Use a conservative approach. For it, that is. It's basically a dry recovery. But if you want its legs to be completely normal, then we must consider surgical intervention. Oh yeah, there is also Liangzi. I think there is basically nothing wrong with Rottweiler now. Rottweiler is fine. Liangzi can be discharged from hospital. No need for any medicine. The wounds are fine. Tomorrow. Can I be discharged from the hospital tomorrow? Can. Director Nana-san said that the patient can be discharged tomorrow. More nutrition. It is really thin. It's hard to think. They are all pretty good. The only thing we care about most is Big Daddy, who is dying. Bigger is not willing to eat now. There is still a very big risk. Watching these little lives looking at us with trusting eyes. No matter how much pressure and difficulty there is in your heart, you must persevere. The furry child also needs to enter the oxygen chamber. Hello everyone, I am a pony. Like our little furry child. Our Fu Wang. President Sun, what about its current physical condition? I can only say it's okay, but if you want to return to normal. What about the weight of a little kid? It will take about 2 months. What if I need it every day? Give it some more nutrients. And the beagle. What is it saying now? Life is in danger. We can give our county a beagle. The medicine used, all for use. This is also a very big difficulty. At the same time, our 3 little fur children are living in the courtyard. What about their medical expenses? Now for us, it is indeed a huge dilemma. Like this one looks like our Fu Wang. And the beagle. What about now? I still have to spend every day in the hospital. But families can rest assured, our beagle and our Fu Wang, we will definitely take good care of them. Hope the fur kids can recover soon. Three fur kids were hospitalized at the same time and we were very busy every day. But there are more than 100 furry children in the yard. We cannot neglect to take care of them. Our director Nana-san said that she can be discharged from the hospital today. Take good care of the little kids in the yard and then go pick Nana up. We have received the dog food fed by fans and their families. Thank you to the fans and their families for helping these injured furry children. So many things have happened during this period of time. We have also been deeply trapped in the business of every day. Rescuing stray furry children means investing a lot of time and energy. It is necessary to observe the physical condition of each fur child, record their health and report any sick pets. Send to hospital for treatment immediately. During the treatment process, a lot of time needs to be spent on caring, feeding, changing, and accompanying the patient. Every link cannot be neglected. Not only that, rescuing stray furry children also requires huge financial support, from the most basic food and water to medical expenses when you are sick. It adds up to a considerable amount over time. The road to rescue is full of unknowns and challenges. Sometimes you may be misunderstood and questioned by others. Being accused of being nosy or even maliciously attacked. Some furry children are sensitive due to long-term wandering. Timid and difficult to get close to others. It takes a lot of time and patience to slowly guide and incubate. But all these difficulties and hardships, in the moment when the furry kids are reborn, It has become very meaningful. What about this morning? I have taken care of all the little furry kids in our yard. What about us? Roshan. Our Nana was discharged from the hospital. Our Fuwang and Jun have a beagle. Look at their situation. See how it recovers today. Our current words, hurry over. I don't know how the hospitalized furry kid is recovering. We are always worried. President's son. We are here to pick up Luoqingna from the hospital. There is also a golden retriever named Fu Wang. And what's that one called? Big. How about now? Fu Wang is fine today. Fu Wang still coughs slightly. But no diarrhea, no vomiting or anything. There is no problem with my spirit and appetite. Bigger is not in a good condition today. It just feels a little more energetic than yesterday. It can stand, but it still doesn't eat. Still panting. The overall condition is still not very good. County. Then I'll go up and take a look. Okay, let's go and have a look. It hasn't eaten the canned food I opened for it yet. At least it's not like yesterday. Just lying there. Still coughing and wheezing. The furry child used the special medicine for 2 days. Appetite is still poor. Appetite is still poor. I can only let it recuperate here for a while. Take care of its body. Today I saw it can lie down. Right, unlike the one who just lay on it yesterday. Yes, I lay directly on it that day. You have to be strong, kid. Fu Wang. What about Fu Wang? You still have to eat some joints. Some medicines for joints. I have to prepare some more delicious food for it. Give it some nutrition. Give it some nutrition. Seeing us coming, the furry kid stood up excitedly to greet us. Nana, come here Nana. I'm here to pick you up from the hospital. Nana, walk. Go Nana. Go, walk. Going around. Going around. Nana will pick you up from the hospital today. Walk. Come with me, please. Nana was reluctant to part with her 2 friends. Reluctant to leave. Reluctant to leave. Nana, they will soon recover and return home to reunite with you. I took this dog away. Is there anything else I should pay attention to? You sit, you sit. No, it has fully recovered. I'll observe more after I go back. This neck area. See the recovery of pimples. A little bit hard. Small area. Nothing else to note. Basically recovered. Nothing major abnormality. Please, my presence. Good job. V. Then take the dog away. Okay, there is one more thing I want to tell you. Just look at the medical expenses during this period. If it's convenient, could you please give us a tie? How much is it now? I roughly calculated the cost. Last month, I owed about 14,000 yuan. Including the counties of Ping'an. Ping'an, it's more serious. It costs about 5,000. And this month? Zhongbifei, white lung. It is around 6.000. Nana, about 4,000. Tool. The above county is Fu Wang. The one with the bad tibia. It is about 2,500, and Big is currently receiving treatment. The current cost is about 1,500. Still receiving treatment. There may be some fees later. The total is about 28,000 yuan. How much do you owe? Let me tell you roughly. Get married as soon as possible and tell Brother Liang about it when you go back. Because it's too long. The cost is also high. We have pressure here too. Whatever, I'll go back and tell my Brother Liang. Then I'll go, President's son. Looking at the densely packed medical expenses on the bill. Several pets were hospitalized and the total amount of money spent was 20,000 yuan. We can't afford to refuse the hospital's payment notice. After all, the fees owed last month have not been settled yet. First contact with the outside world. There must be some fear. Go Nana. Nana is gone. Each examination fee, medicine fee, nursing fee, They all remind us of our economic luxury. Brother Liang has taken on several jobs to pay off his debts. During the day, we hardly see him in the courtyard, but it still fills the gap between the small courtyard and the kill. The hospital bills have not stopped increasing while the fur child is still in hospital. Nana has just recovered and needs individual care. Let it slowly get familiar with the courtyard life. Just as the fur kids were getting to know each other, the hospital received a message saying, The hospital received a message. Erotic dog stock. Dog. When did it disappear? About half an hour. Can it still pump adrenaline now? There's no breathing or heart rate. It was gone all of a sudden. It just started panting heavily. Then the lungs may not be able to expand. Suddenly I lost my breath. I was so angry. The thing we were most worried about happened. I don't know what to do for a moment. It's hard to accept. Rub it on your body. Even if you walk, you have to walk in a dry way. I thought that saving the furry kid would give it a new life. How cool is that? Just rescued. But Chia's furry child never had a good day. Covered with scars and suffering from pain and torture. Covered with wounds and suffering from pain and torture. Take out all these indwelling needles. We have made so much effort, how could it be? We have made so much effort, how could this happen? We have tried our best. There is no way I can do anything, but I have tried my best. All the necessary treatments have been done. Sometimes it's not. If you do something, there will be a result. There is really no other way. Don't be too sad. Maybe leaving is a relief to do it. Indeed, we have done what we should do. It turns out that the most painful thing is not losing. It's watching you struggling in pain but unable to do anything. Maybe you are too tired. Even the final farewell was silent. If leaving is really a relief, then run to the Rainbow Bridge without any worries. There's no pain. There is no sickness or pain there. A beagle with only 3 legs was abandoned by the river. After being rescued, the first reaction was to look for the owner everywhere. He received help from a fan friend and found out while fishing by the river, there is a dog in a sack that keeps barking. Contact us immediately. Good. Okay, good boy. Okay, good boy. Still a bigger. Hold it out. Okay, dear. Oh my God. 1 leg missing. Why is there still a leg missing? Okay. Okay, good boy. Look, it's scary. Shall we get water? Take it and put it on our tricycle. I'll get it for you. I just want to see its legs. For the pony. This little guy is thirsty too. The weather is hot and they are put in sacks and exposed to the sun. The furry child kept panting and didn't know how long he had been. Looks pretty good too. Why do you think people throw it away? And threw it into the river. If it really feels scared, if it really fell down. I really don't dare to. I can't bear to think about the consequences. Look at its legs. How do I see? It's a bit like the feeling of a new growth. Is this acquired or innate? The furry kid is missing 1 leg. Was it abandoned by its owner because of a disabled woman? Half of this ear is missing. I didn't expect that the fur kid's ears were also missing a large part. What on earth did this furry kid go through? How much damage has been done to make me look like this? Drink some water. The furry child's eyes are full of gloom and grievance. We will take it to Dean Sun County later. Drink some more water, dear. Its amber eyes are misted, like two deep lakes reflecting the cold rain. Fear and expectation entangled in that look. Obviously covered with scars, but still maintain the purest trust in human beings. The furry child drank some water and recovered a little. It stumbled to its feet. 3 legs draw messy arcs on the ground, trying to catch the familiar smell in the air, looking for the owner everywhere. The cruelest thing in the world. After being abandoned by someone you trust, but still stubbornly holding on to expectations. Use the broken body to exchange for the master's valve. Looking everywhere just to find that figure who will never look back. The search was fruitless, and I felt very aggrieved and sobbed. Why did the master abandon me? We rushed to the hospital with our fur baby as soon as possible. President Sun, our newly rescued puppy. Look at how it made its legs. And you see, it has no energy at all. Look, there are new buds growing here. Dean Sun was also very surprised and felt that it was not congenital. Can't connect. And its ears, legs like this. These 2 ears are for biting. Is this man-made damage? The ear is falling off. A piece of my ear fell off. Human possibility. I don't know. Anyway, looking at this shape, it's not. No, born like this. The furry child was breathing rapidly. Dean Sun asked us about the rescue scene. I suspect the fur kid got heat stroke due to the intense heat. Is it heat stroke? Heat stroke or something like that. Look at the status. How big is this? Not big. 1-year-old, right? No, yes, no, there isn't. 1-year-old should not have. My God, good puppy. People threw it away. People may feel that they don't want to be disabled anymore. The furry child lost a leg when he was less than 1 year old. 1 ear was lost due to human error. What kind of person is the owner of the furry child? 40 degrees. Fever. Fever is probably heat. It's heat stroke. Heat stroke is divided into heat stroke and sunstroke. It may be like this. We're going to check it out. The doctor initially suspected that it was caused by heat stroke or other infectious diseases. It is necessary to test your furry children for infectious diseases. There are many reasons for fever and wheezing. This virus doesn't exist. These big pox, small crown. No problem. Virus. There is no virus. Now it's panting and having a fever. I think it's a respiratory problem. Possibly pneumonia. So how do you do this? Pneumonia or stuffy fever? Heat stroke. I need another blood test. Take a picture to see where the problem is. Then accurately diagnose whether it is hot, or is it a problem brought about by pneumonia. By the way, let's take a look at this leg. Mainly put it in a sack to keep it stuffy. I don't know how long I'll be bored. Possible heat stroke. To rule out 7 viruses, further blood tests are needed. The child was breathing rapidly and the doctor suspected it was pneumonia. How is it, President Sun? Watching the movie. Have pneumonia. This lung now. Pneumonia is quite serious. The normal outline of the heart. The heart outline is all black. Then this piece is completely connected to the heart. It's all white. Whitening means lungs, lung fluid, become substantial, caused by inflammation. I can't even see its heart clearly. Alveolar pneumonia. Is this serious? This is for doing it. Pneumonia is dangerous anyway. It must have taken quite a long time to look at it to this extent. Jeez, then it. Is this arm congenital? Or the day after tomorrow? The arm is not congenital, not innate. That means it might have been given by its previous owner. Or other reasons. I don't know. Anyway, it's about the development of its bones. It's normal. Look at these joints, they are all normal. Then suddenly it was gone. This must be the one that didn't exist later. The child was diagnosed with inflammation, fever, and wheezing caused by pneumonia. The injury on the leg was definitely acquired. Let me tell you about the test results. Watch it on film. The film mainly shows pneumonia. And what about the leg? It's not a congenital developmental problem. Right. The pneumonia looks more serious. The whole lung. It feels like half of it has turned white and deteriorated. It may be slower to recover. And what about the blood test? Inflammation is also high. I have already reached the maximum limit. I didn't do biochemistry on it. Make one of these. Serum electrolytes. What about electrolytes? Then there are some ionic anomalies. The methyl ion is low. This may be due to the influence on its lungs. Because it breathes. This isn't necessarily what you're talking about, right? Yes, there is also a blood test. Blood test is also good. Slightly anemic, but it's not that serious. The main problem now is the problems caused by pneumonia. For example, fever, panting and not eating. Dean's son said that the child is now in a very dangerous stage of pneumonia. The temperature reached over 40 degrees and the breathing was rapid and appetite and spirit are also in a state of dryness. Immediate cooling treatment is required. The inflammation caused by pneumonia has reached its peak. Dean's son said that his life could be in danger at any time. Dean's son said that his life could be in danger at any time. One of his legs was amputated when he was less than 1 year old. The ears were also cut off. Even though I have suffered so much, I was still abandoned in the end. Hello everyone, I am Xiao Ma. Yesterday, our Xiao Ling also completed the operation safely. I feed it a small amount of canned meat every day. What about today? Let's take some of this chicken thigh meat. Give it 3 more eggs. Go to the hospital and see it. Give it some nutrition. Light snow. Light snow. We're here to see you. Little snow. Getting an injection. Getting an injection. Xiao Ling brings you chicken thigh meat today. And eggs. I'll feed you later. I have to cook it for you. The day after the operation, Shushue was in much better condition. When you see us coming, stand up. When he saw us coming, he stood up. Xiao Ling looks good. I wonder how his appetite is. Cook some chicken thighs and eggs for it to supplement its nutrition. After the injection, give it a shot. Right. Light snow. Look at your ears. Look at this ear. It's just this piece. Just this one. Apply medicine to it again. This ointment is still useful. This. About a week or so. More than a week. Now, it's almost recovered. Very effective. Especially effective for, if it is this place where. The place where you divide is not special. Not particularly easy to handle. There's no way to interfere with it anymore. Because the injury was too severe, right? Look, right? It can't be closed now. Cannot reset, right? Can't fit in already. The reason for the surgery is that my child's legs are still swollen. We carefully applied anti-inflammatory medicine to the wound. You know to lift your legs. So obedient? Very cooperative. Just 2 days ago, our fans bought this shark cartilage specially for us. Feed something nutritious. It will definitely get better faster. Right. The child suffered great pain after the operation. We need to give it some more nutrients. Look how obedient you are. It's not like it was at the beginning. At the beginning, can't lick. We can't lick it no matter what, we still have to put it on. It always licks well. Always licking its legs. This doesn't matter. For the newly sown, stop licking it. The main thing is fear of infection. Infection is not easy to deal with. Dean! Wait till the thread is removed. After the thread is removed, we can take it back to the yard. What happens after you bring it back to the courtyard? Let's take care of it ourselves. Then do some rehabilitation exercises. Let its legs move as soon as possible. It is to be able to return to normal dog's walking ability. If it's front legs, we don't have to worry. Because currently the front legs, it's not a big problem for doing it. We'll see after its hind legs have fully grown. We are considering surgery on its front legs. Actually, what is Yeshua's current relationship with us? It is particularly harmonious, not like it was at the beginning. At the beginning, they were particularly rebellious against us, don't want us to touch. He didn't want us to go and shave it. But maybe it's getting better now. We are becoming more and more familiar with each other. Like no, shake hands, Yeshua, come. Very obedient. Everything has to be done slowly. Now, basically, you have to disinfect it every day. Especially this blanket. Because its wounds hurt. I'm still very afraid of infection. To prevent infection of the pet's wound, we are very careful with anything that comes into contact with our furry children. Not too warm. Okay. Wait a minute and let it lie down slowly. Slowly. My body is still too weak. I just had surgery the other day and I'm still not feeling well today. Director Sun said this operation was very complicated. The pet is already weak and will inevitably be affected by the surgery. Boil. It will definitely like to eat it. There's oil floating on it. After 100 days of injury, your furry child still needs a lot of nutritional supplements to help its body recover. Come and eat. I'll give you some of this nutrient paste. Supplement nutrition. 3 tablets of shark cartilage. As soon as I ate, I stood up. Right. Give it a stir. Stir it. Look how good its appetite is. You can also be happy. Yes. We are very pleased to see Yeshua's appetite and spirit. From the beginning to the end of the operation, our hearts were hanging. I'm afraid that something unexpected will happen to my furry child. In fact, I am most worried about it after the operation. Unwilling to eat, this is what I worry about most. But seeing this situation today, cook for it. Look at it eating so delicious. In fact, it's good from the heart. That way we can rest assured. The proof is to complete the operation on it. What about its impact? Maybe the damage to vitality will be more, but nothing has changed, like my appetite. What about appetite? Maybe it will be better before this. Wait, it will recover slowly. Can run. Able to run. It's even better. I just said you can't see. Licking again. Here comes goat milk. Come. Goat milk broth. Have 2 more sips. Come and have 2 more sips. Drink 2 sips and you'll feel better soon. After the hair grows out, it will definitely look great. But if I shave it now, there might be some lack of grass. Kindness. Taikao. But there is no way. Eat enough. I just heard it drinking. This time it's delicious. watching him fall asleep after eating and drinking. We can go to work without worry. This dog looks white and fat to me. If you say you don't want to raise it, then don't raise it. Just because of this little thing, it's worth not raising it. No, I asked you to bring the dog. Can you take it away? I didn't ask you to teach me. When I was taking care of my furry kid in my courtyard, I received a message for help from someone in the same city. He said he had a dog at home and didn't want to keep it anymore. My furry kid pees and poops everywhere every day, and everyone in the family is disgusted. See if we can take the baby away. Come. You guys are finally here. Take it away for me now. What happened to this dog? You don't want to keep it anymore. Brother, this dog has been raised for 8 or 9 years. We were very surprised to hear the dog owner said he had raised his furry friend for 8 or 9 years. Why would you abandon your furry child after raising him for so many years? How can we not have a trace of affection after spending 8 or 9 years together? This dog looks white and fat to me. Just say you don't want to raise it, then don't raise it. Just because of this little thing, it's worth picking up and don't want to raise it. No, I asked you to bring the dog. Can you take it away? I didn't ask you to teach me. I'm sorry, bro. Mainly, I am looking at this dog. You've been raising it for 8 or 9 years, right? I've been raising it for 8 or 9 years. Are you a little bit about it? Don't you have a loving heart? I'm just asking you if I can take the dog away today. Can't take it away. I sold it. Don't miss me. Don't miss me. Don't waste your time. What if I take it away? Since you don't want to raise it, I will definitely take you away. I mainly look at this dog. Look at home. Living at home is pretty good. If you come to my courtyard mainly, there are more than 100 dogs in my yard. Maybe not so comprehensive. Mainly. Are you sure you want to give it to me? If you can take it away, please take it away now. I can't support it at all. What is it called? Call this dog Tron. String. Look how affectionate this dog is. We asked the dog owner, since he has raised the dog for 8 or 9 years, why do you suddenly not want a furry child? The dog owner said that due to work, too busy to take care of it. Then my family didn't like it either. I hate it for peeing and pooping everywhere. I don't want to raise. And now the kid is sick. After asking the dog owner, we learned there seems to be something wrong with its butt. The furry child's butt looks red and swollen with a bulge outwards. The dog owner did not take the furry child to see a doctor. Only contact 7. We hope to take the fur baby away. It seems to be inflamed. Come and have a bunch of fun. The furry child seems to feel that the owner doesn't want it anymore. It ran to its owner's legs and kept trying to be nice. With innocent eyes, I look at the cruel face of my master. After raising her for 8 or 9 years, she just said no. No feelings at all? The tone is full of disdain for the furry child. How did it get its eyes? It has many polyps in its eyes. There seems to be a piece of flesh around the eye. Yes, you know how it got its eyes. I don't know. Too old for that. I guess it's something about old age. Are you sure you don't want this dog? I don't want it anymore. If you can take it away, take it away. Take it away quickly. Xing xing, county line, xing xing, county line. Then I'll take it away. Then take this dog away. The owner of the furry child showed no reluctance or love for him. They urged us to take the baby away. Master, what did I do wrong? Don't you want me? Will I never be able to stay with you again? Master, look at me. I will be obedient in the future. Please don't want me, please. The fur kid had problems with his butt and eye, so we rushed him straight to the hospital. This is someone who doesn't want it anymore. People don't want it anymore. Give it to me. Dean's son, look at its eyes. What does this look like? Subcutaneous eyelid hyperplasia. What is it called? Nitrous membrane hyperplasia. How to do this? The one who puts eye drops first. See if it goes away. Wait, let me pinch it and see if it can go back. If you can't go back, you need surgery. The furry child's eyes are hyperplasia of the nictitating membrane. There are also risks of surgery. Is the anus too small? Anal contraction. Not sure. Normal anus is not like this. Congenital anal contraction may be. Anal contraction. Anal contraction causes inability to defecate. How did the owner of the congenital anal contraction take care of the child for the past 8 years? Little horse, listen to it sobbing. Home 6-7 miss its owner. Well, it doesn't know why its owner abandoned it. It's also very sad. Very uncomfortable. The owner doesn't want it anymore. The feelings of 1989 are a belief engraved into Chinta's bones. It is a promise that I am willing to protect with my whole life, and for its owner. But it became a discarded old thing. This puppy? What about the eyes? Just gave it some local anesthesia. I'll try to turn it back later to see if it goes back. What if I could go back? No more surgical intervention. It may bulge out again after you go back. Let's talk about protrusion, but together. I think it's congenital anal contraction. Abnormal development of the anus. Then I'll take a picture of this. Is there a lot of feces in it? Is the intestine already noticeably thickened? What if there is a noticeable thickening? That must be an anal. Then a lot of bowel movements caused. Xing, we are doing treatment. We need to take x-rays of the furry child for further examination. It seems from this film that this is a congenital problem. Causes the anus and intestines to be narrow. You can roughly see this kind of stool. This is called colon. It's very normal. Normal can be felt from the rectum. This is very subtle. After very fine, then the front is wide and the back is narrow. I can't defecate, then the anus is also narrow. Can't get out. This part of it is a developmental malformation. It's 3 or 4 times narrower than normal. In this case, it is caused by congenital. Congenital. What are the means of prevention? What about the sheep segment that intervened? Just do surgery. But the cost of surgery is high. You have to put it behind the bone. If you have surgery, cut it off and move this part over. Then this sheep technique is passed through the pelvis. We need to open the pelvis. Just cut open the pelvis. Yes, cut open the pelvis. After cutting, move this over and cut it off. After moving over, then fix the pelvis. Opening the pelvis is a very tedious task. It takes 2 to 3 hours to complete. Open and then add the transplant. This surgery, the cost will be high. Longer surgery time. Post-operative recovery is not certain. That's the surgical plan. There is another solution. It's because it's not particularly thick now. Then we can soften the stool. Eat some sesame oil. Eat some oil soup. Just let it have loose stools. Let it pull itself out. If it can pull out, it won't affect its life. But if you eat it, the stool will not be very good. Then you have to try to operate on it. Anyway, it seems that the situation can be improved now. It should be able to be discharged. Oh, now you can observe first. Use some sesame oil and observe first. Because of you, this is a complete improvement. Because it's deformed, the only solution to completely improve the condition is surgery. Go change this paragraph. Xing, the price is very high. Because it's on you. It's quite dry to make a replacement. What about the surgery cost? It's also more troublesome. Also relatively expensive. Let's take a step back. That's it. Drink something to defecate first. I just want some softener. Let it drain out by itself and keep it like this. If it can be pulled down. Xing, this is also possible. Both options are possible. Director Sun said the operation is very risky and the process is complicated. The furry child has to endure the pain of pelvic incision. Post-operative recovery is also an uncertain factor. And the cost of surgery is also very high. Conservative treatment is slower. But the furry children will suffer much less pain. Tuck it in. Well, did you go in? So awesome. It's back to normal now, so I don't need surgery anymore. This one. Director Sun took conservative treatment for the furry child's eyes. Plug the nictitating membrane hyperplasia back, reducing the pain of surgery for your pet. Dean Sun said that giving your pet more sesame oil can soften its stool. Slowly excrete spontaneously. Also pay more attention to the defecation of your fur child. Give it as much porridge as possible. Its lifespan is only a dozen years. It may just be a part of your life. You are all its life. Please don't let it become a victim of your whim. D. President Sun. President Sun. Please take a look. It can't even walk steadily. I don't know how to do it. Both legs are shaking and very thin. Just rescued. Right. Let it go and let me see. Can you go? I'll try it for you. When I just put my daughter there, let her go. You can't leave now, right? I can't move on it. There's nothing wrong with the appearance. I didn't see it. I won't touch it either. Both of its legs are pulled inward. Is this malnutrition or deformity? Bone and joint development. Check whether the tibia is inverted or valgus. Looking at the skinny body of the furry kid. The doctor felt sorry for the dog because he had never seen such a thin dog. Now it can't straighten its legs. This ligament is very tight. It should have been shrinking like this since childhood. A common cause of shrinkage. One is tibial varus. It will be like this. It's the kneecap. Can't pull it. This bone deformation will be like this. Or some calcium deficiency or something like that can cause bone deformation. I haven't eaten anything nutritious since I was a child. Or a cruciate ligament rupture. It's a big deal to stand up now. Tibia varus. Dean's son carefully examined and touched. It's a joint disease. This is normal. This is called the pulley ditch. This ditch is deep. Then there is a bone on this side that is placed in this groove. But now this bone has come to this position. How to do this? This can only be done through surgery. Surgery to deepen the trochlear groove. Tibial plateau displacement. The breathing is so loud. Surgery is the only option, right? Only surgery is possible. If you take medication, treat it conservatively. Tibial varus is divided into 1,234 levels. This is the most serious of the 4 levels. It can't even get you back from class. Serious. But I see its current physical condition. Very bad. It is relatively thin. Anyway, if you want to intervene, correct this bone and joint problem, I can only have surgery and see. So serious. After the correction, it will definitely be better than now. But I'm not sure what I can recover to. Because it has been deformed so badly. Then after you pull it over, this shape will also have some. Not like normal joints. Once you correct it, it may take a long time to recover. You're still dehydrated. Skin is very dry. Nutritional status is also poor. The furry child should be in a state of lack of water for a long time. The body is already severely dehydrated. The wandering time must be very long. I couldn't find food anywhere. I was skinny and had very poor nutrition. Gums and teeth are pale. Even my eyelids turned white. Even the sound is so weak that it is almost inaudible. Dean's son kept sighing with heartache that the anemia was too serious. Its ears were not immune to ear disease. It's hard to imagine how the furry kid survived. A more comprehensive examination. It is necessary to conduct a comprehensive blood biochemical test on the furry child. Check whether the internal organs are damaged. The legs need to be filmed for further testing. How is it, President's son? This is caused by tibial varus. You watch this movie? This bone. It should be placed in this slot. This is called the pulley ditch. Then we are already outside. And it feels like some growth. The edges are not rounded. Long-term friction. This side is heavier. This side is basically quite dry and looks like it has grown. This side. Bandhuban can't move this bone. Normally it is placed in this bone. Then what about the bone below? Normal should be flat. It is a triangular bone. Then this. The extra ones here have been pulled inside. Just these 2 tibias, already pulled, completely deformed, so it can't stretch its legs. Oh. This is what causes its legs to buckle inward. Right. How did it cause this? It was when I was a kid. Many of them are caused by genetic factors. This is usually more common in small dogs. Lady, Bichon Frise, this kind of small body is more, but it doesn't mean there must be nothing else. Other dogs also have it, but it is relatively less common. This is particularly serious. Level 4. In that case, the only option is surgery. If you want to correct it, you can only do it through surgery. There is no other solution. Recovery from surgery is also a problem. Recovery from surgery will definitely not be like normal. That's so good. The risks of this surgery. The risk is that it may be infected or something after the recovery. Basically, it won't appear. The bone displacement of the furry child is the most serious level 4. The only treatment option is surgery. The operation is also very complicated. There are 4 steps in the operation. Can straighten your child's tibia. The recovery at the same time is also a long process. What are the test results of President Sun? Test results. There is a problem with this internal organ. This is alanine aminotransferase and alkaline phosphatase. These two are liver indicators. Alanine aminotransferase is already over 400, normally no more than 140. Alkaline phosphatase is also more than 400, normally no more than 150, so much higher. Yes, it means that the liver is affected. Then there is another high level of creatine kinase. This is high. It's probably caused by the muscle damage in its leg. A high. All muscle damage will cause it to be high. It may be caused by bone and joint problems. This one is a bit outrageous. This enzymatic indicator is more sensitive. Once there is a problem, it will be high. The indicator is indeed high, because it definitely affects the liver. CRP inflammation index is relatively high, already bursting the maximum upper limit of Dargan. The results of the examination showed that the indicators of the fur child were off the charts. The liver is also damaged by 7 diseases, such as dehydration, inflammation, anemia, etc. The most important thing now is to adjust the physical indicators of the fur child to normal. Director Sun said that its liver is seriously damaged. Need some liver medicine. The surgery cannot be performed for the time being. My physical indicators are too poor. The fur child is very old and has been wandering for a long time. The body is seriously damaged and the spirit and appetite are not good. Give your furry child anti-inflammatory and nutritional supplements. The most important thing right now is to take care of your child's body. Wait until the body's indicators return to normal before you can proceed to the next treatment. If you want your furry child's legs to recover and walk normally, it can only be completed through surgery later.